Good morning. Good morning, Anna.
Hello, good morning. Hi, Nurse One. Hi, Dr. Nurse
Hello,
Paul.
everyone.
Hi, Nurse Anna. Good morning, Nurse Juan. We are so happy to have you
We're
here.
all
Kate could not join, but thank you for coming, Nurse Juan.
Last
And we
minute
love,
yan, ha? Always
yeah.
available.
of course. And we have a very special topic today, guys. Today's episode 44. Can you believe it? Episode 44 of DNP Unlocked. We're talking about nurse patient ratios, but for our
Mm-hmm.
viewers, our past shows are available in podcasts, all right? And Nurse One has been our special guest multiple times. So please follow us in Apple Podcast and Antok pa, and Spotify Podcast. And how are you doing, Nurse One and Nurse Anna?
There's Ana. Ikaw muna.
Um, okay, good morning, everyone. Now, well, it's kind of getting cold here in New York. Yes, few more weeks, and we're entering into fall season. And our topic is very, controversial because this is one of the most top topics in my hospital. And I can't wait to share all of the things and bits of this. But other
Right,
than
right.
that, I had a rough night last night, and yes, I almost rode a helicopter last night.
Woo-hoo.
Nurse One and Dr. Nurse Paul.
We're
It was
gonna transfer a patient.
yes, because we are short staffed.
Mm-hmm.
I
Oh
was like,
no,
but
Ay, wag ko.
today we're gonna go drive into that. And
short
thank you,
staff.
Nurse One. Yes, thank you, Nurse One. We're not short because of you.
We're not short
Okay lang.
staff today.
I'm just lucky, like I'm awake. I'm not doing anything. It's like, oh, I remember there's a live show tonight
Yeah,
or today. So I was
you're
like, okay, let's join.
yeah.
And
Every
I like these topics also. So works
every
for me.
Sunday that you're available, you're always welcome to join. And
Thank you.
the crazy part is we hear the word short staffing all the time. And when I used
Yeah,
to work in the Philippines, guys, it's we don't complain, right? Like I would
that's
run
the
the ER with
normal.
I
That's
would
the
run the
normal.
ER with two nurses. So when I moved there, like when they gave me four patients, I said, that's it, four patients. But I didn't realize that because of more expanded scope for nurses here and a little more autonomy, I didn't realize that even though it's four, it still feels like running the whole ER. That's at least for
Yeah.
me. So four,
Mm-hmm.
but lots of responsibility still. And you're always scared that somebody will sue you, so you're always on your guard. But um, our template for nurse patient ratio is actually California, so I hope it's like that in the whole country. But today we're going to talk about nurse patient ratios and what immigrant nurses who have practiced somewhere else need to know
Mm-hmm.
about that, right?
How about you, for Nurse One? How are you been going this past few days?
Ah, so far so good. Can't really complain. Got a couple of good news, but I'll keep it in a few more weeks before I give some good news.
All
Uh,
right.
Yay, we'll wait
uh,
for that.
Well,
yeah.
we'll wait in your social media for sure.
Yes.
So there's a lot going on in the personal life, so a little bit busy on doing the stuff. So less social media things, but
Yep, yep.
um, sometimes it is what it is. So we just have
Mhm.
to do whatever we can. So far for work, been pretty much stable for the last 1 year. I've been a year now in my place here as a local travel nurse, so it's like time flies.
Yay. Mm-hmm.
In California, right?
No, I'm not in California. I'm still here in Kentucky.
Oh, nice, 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 nice.
Mhm.
How's the fried chicken?
Uh, Still okay.
Midwest, Midwest, love it. So, is there nurse patient ratio in Midwest?
Uh, Not per se. They're trying
Hmm.
to implement some of it now, but
Yeah,
it's
yeah.
still not implemented. So
Mm-hmm.
that's why I also want to give some information because I think my state has a mixture of how many ratios, like different versions for the last four hospitals that work here. So it's like
Hmm.
every hospital is different, and we
Right.
really wish it's the same with California. So
California.
which
California won.
which is
Right,
not,
right.
unfortunately. I think Oregon also adopted similar to what California is doing.
I think so because they're neighbors to California. I think I've heard some nurses have nurse patient ratio mandates there too, which is that's how it should be in the whole country. So
Yeah, yeah.
California nurses, you guys are peers in California. You guys are spoiled. That's
Marvin,
good. Well,
Marvin.
Oh,
yeah,
Marvin
Marvin
Yedlin,
is not
no?
even here to join us. Yeah, and let's acknowledge our viewers today, Anna.
Hey, good morning, everyone. Thank you for tuning in. I know a lot of people are waiting for this, especially the upcoming nurses. Congratulations for those who are current, right? There's one, but for those
Yes,
who are
yes. Woo!
current,
Yay!
EB3 moved 2 years. Woohoo!
we are
Love it,
so
love it.
happy for you. We're so happy. Congratulations for not giving up, for even if the progression happened. Yay! Current
Yay!
na! Sabi ni Lola, hindi nag-exam.
Yes. All three of us here are products of retrogression, right?
Retrogression.
Yeah. Especially those people that have not taken NCLEX yet. Uh, I don't think there's a reason to celebrate just yet. Pass your
Mhm.
NCLEX first. There's Nurse One. I don't know if you guys get this message, Anna and Kay. Kay is not here with us today. She has a family event. But I don't know if you guys are getting this message, but um, a lot of our immigrant nurses think that because of retrogression, they could not apply for EB3 or I-140. But I keep saying you can still apply. You can still find
Yeah.
employers, right?
Mm-hmm.
It's just that
Mm-hmm.
you're not going to get interviewed. You're going to stop at National
Mm-hmm.
Vision Center. So there's an idea that because of retrogression, nobody would hire. That's not
Mhm.
true because hiring is continuous, right?
Mhm.
And the
Yeah.
earlier that you can get hired is actually the better because that's how the priority date is stamped. So always remember this: if you don't have a priority date, you should not be worried about
Yeah.
retrogression yet, because it will not affect you because there's no process just yet. So that's it. That's my message
Yeah. You have
for
to be
the
on the queue first. Okay, you
yes,
have to be on
yes,
Yeah.
the
you have to be
queue.
in the line.
Okay, so
Mm-hmm.
if there's no PD, you're not in the queue, and everything is useless. The waiting period. Okay, that's actually
Correct.
one of my mistake before, Sir Paul. I had some
Mm-hmm.
issues with my hospital that provided me with a priority date, and it ended
Mm-hmm.
up not giving me one for last 2 years. So waiting
Oh,
time. So
Oh,
wow.
yeah,
Mm-hmm.
that's
wow. So
yeah.
sometimes
So
they
how
do
many
that.
years? How many years in total you waited because of that mistake? There's one.
They were
Yeah.
like having some pending issues. It was the midst of we're
Mm-hmm.
in the start of retrogression, so they were giving us experience. So I was okay getting experience from that hospital, but the processing of the priority date wasn't really going as smooth as it's supposed to be. So
Mm-hmm.
Mm-hmm.
I was there like for 2 or 3 years. Then they finally told me like they can't do anything about the priority date, and
Oh.
so so that was my
Which
But
is
first.
look, you're here now, right?
Yes,
You never
yes.
right.
gave
Everything is
up.
in the past. Yeah, yeah,
Mhm.
true.
Mm-hmm.
Yeah, in my case, what happened was I was actually abandoned after waiting for like 5 6 years, and
Me
I'm
too.
going current in the following month, and my employer's like, "Nah, you don't have current bedside experience. We're gonna drop you for now, and we're gonna find someone else." So that's the
Mm-hmm.
hard part. They didn't consider teaching as because they want
Bedside
bedside.
experience.
Yeah, so
Mm-hmm.
I had to look for an employer that actually counts my teaching experience as well. So it's a little hard, but look at us now with
Yes.
Yeah.
passports.
Malayo na.
We never gave
Malayo,
up. We
malayo na
never gave
narating,
up.
yes. The
Yeah.
ultimate, for me, the ultimate dream for nurses pa rin from the Philippines or even from our folks from Africa, because there's watchers from African region, South
Mhm.
American. I think the ultimate goal is still the US because they always see how
Yeah.
much nurses are getting paid here. Even my peers in UK, we get to compare. Nurses here still make a lot of money, especially if you're in California, like our rich nurse Marvin.
Marvin, who always go home in the Philippines
Yes.
every 3 months
Yes, because it's RN
Dora.
rich nurse.
in California.
Yeah.
Dora Marvin
So
the Explorer.
but yeah, but even then,
You're
even if
right, Marvin the Explorer.
Marvin the Explorer, that should be his social media name. Hi Marvin. He said he couldn't join because his internet in the Philippines is bad.
That's
So
what happened when you're not here.
we talk about people who are not here.
Yes.
But anyway, but yeah, that's actually a good news that it moved. Hopefully it stays like that. I'm a little nervous with
Mm,
how it is. Um, um, Cross fingers. Hopefully it moves. But regardless, we just want to encourage nurses to keep applying, keep finding employers, and just don't sign out of desperation. I know everybody wants to go to the
yes.
U.S.,
Mm,
but you don't want to be in the news in Lefora because you're part of the lawsuit or your employer sued you. That's really not a good experience. We're lucky, Nurse One and
Mm.
Nurse Anna, that we have, we didn't have that experience where we had to sue our employers. I know Anna had to leave her employer or something like that. I'm not sure. With me,
mm,
um, I finished my contract, no problem. So, it kind of like took off another burden for me because it's so hard to move over here. Like I thought I was a
right.
very independent person, but when I got here, within the first 3 to 6 months, I'm like, I'm about to pack my stuff and go back to the Philippines.
Mm,
The homesickness is real, right? Especially I was single, I didn't have anybody, I have new friends, but I
mm.
feel like, oh my God, I'm going back to start. I'm already a professor in the Philippines, I run a business, something like that. What do you guys think?
Well, when I arrived here 9 years ago, just like you, I was also abandoned. Not once, twice. I was
Ooh.
abandoned twice. And I was at progression 8 years. I arrived here with my family, with my husband and daughter, who was 4 year old then. But we don't know anyone. We have no friends, no relatives. So all by ourselves ang drama namin. So it was
Oh
hard,
wow.
but
Yep.
you know what? For Nurse Paul and Nurse One, I think the best thing I can advise to our future immigrant nurses is to never give up, never stop prepping for your American dream. You graduated for BSN, we're blessed, we have 4 year course, take your local board, and like Nurse One said in one of his video, I Nurse One, I follow you and I watch you. If
Yeah.
you can, if you can,
Notifications
take
on.
yeah, if you can, take your NCLEX ASAP, right? There's
Right,
one
right,
because
right.
Yes.
at the end of the day, yung pa rin ang gagawin mo eh. So why procrastinate? So don't
And
Right.
stop.
you have
Mhm.
other advantages if you're like in the Philippines, or like you can work for like call centers and earn like, I think they're earning like
BPO.
85,000 to 100,000
Mhm.
pesos now for having a USRN license. So
Yep.
that's a really nice side hustle
Yeah.
if you're not
Yes.
able to work in the US yet. And for me, it's one of my best experience working in a BPO under a USRN license. It was like
Mm-hmm.
Mhm.
uh, an eye opener versus working in the hospital for me. So
Right.
that
Yeah.
was a big leap for me.
That's insurance, right? Utilization manager. So
You
that's still a
are.
nursing
Mm-hmm.
job. Yeah, yeah.
Yeah,
And
it
that's
is.
pretty good money when you're in the Philippines. So our Filipino folks, you are lucky because we have BPO that offers really good money for US
Mhm.
nurses or NCLEX passers. In other countries like Africa or South America, or I'm sorry, regions, and even Europe, they don't have that. But there's still
No.
option for our Asian folks to work in Middle East or Europe. So a lot of them are in Germany waiting. But the main
Yeah.
goal is to do something productive related to nursing. Try not to move out of nursing while waiting
Mm-hmm.
for the US because the ultimate goal is still to go to the US, right?
Amen.
Like, look at Canada, very near to me in New York, but they still want to come here in the US.
Yeah, yeah,
So
Canadian
that
nurses.
everyone, yeah. So
Yeah.
please don't stop. And if you are watching, our topic today is very controversial, and it will help you because a lot of people are sending me messages. I know you too also receive. Ilan po ba ang ratio when you work in med surg or nursing home? And like Kay always answer in the aura, in New York, one is full the whole hospital. So I'm not
One is
sure
to the
about
whole
in
OR
site.
floor.
Yes, I'm not sure in Texas or in Kentucky. Actually, we have a good location. I mean, different areas. Our nurse all work in ER. Meanwhile, nurse one work in floor, and I work
Mhm.
in nursing home before, and now I'm working in OR. Sometimes I got pulled up in recovery room or labor and delivery. So we have so much things to share about nurse patient ratio. So let's go dive in.
Yep, I have a question for you guys. Why do we need to have a conversation about nurse-patient ratio for our immigrant nursing folks. Why do we need to talk about nursing-patient ratio? Why do we always hear this talk in American nursing groups, and why is everybody complaining about it?
Okay. Uh, can I start?
There's one.
One,
Yep, yep.
yes.
So for me, on your interview stage, it is one of the best questions that you should ask. Okay,
Yeah.
Mhm.
that's the tone of your US dream. Like for me, I didn't know like 1:8 to 10 was super high at the time, so that was my ratio in my hospital. And actually, the
That was
average
for
for the
normal.
yeah, that was the normal for that hospital. And I thought it was. I thought it was
It was good.
it was good. It was bad.
No, because in the Philippines you have 20 or something, right? So
Yeah.
you thought, oh, this is good. It's eight.
Yes, yes. I think I have a 14 to 16 average duration in the Philippines, so it's like
Yeah,
10.
Oh
So
no.
muni lang yun. So,
eight.
but
Yeah,
it wasn't. Okay,
it's
so it was
different.
hard. Thankfully, the hospital was bought by another hospital. It went down to 7 to 8, which is
That's
still
still a lot.
a lot. So it's like,
Yeah.
so if you guys would have the opportunity, 6, 7 is like high, a bit little bit going to the high, but normal high. Okay, 5 to 6 is most like typical in most places, from what I understand. Okay, so that's one point I can give you guys. That's why we're discussing this. So kind of help you evade some of the hospitals, and hopefully
Mhm.
you can put those into writing, because if not, that might not be worth
Right.
fighting for. You get some issues. Boodle is real sometimes in the US also. So
True. Yes. Yes. You gotta stand your ground too, because they
mhm.
think as immigrants, there's a stereotype that they're just gonna say yes, because they're new here in the
Especially us
states.
Filipino,
Yeah, they
right?
sound
Yes,
different. They
yes,
look different. They say they're new here. They're naive. They're just gonna say yes. So let's give them eight while we get
yes,
six. But guys, eight. Like with me, I am telling you guys, when they
We
told me I'm
are.
gonna get four patients in the ER, and in my last ER job in the Philippines, we would get the whole ER, and there's only two of us, so we could be running codes. It's just us and the resident, something like that. But so far, it's like, wow, that's like super chill, but it's not, because so much responsibility. Primary care is primary care here. You probably would have
Mhm.
tech, and you're lucky if the tech likes you, or the
And you
tech
have no
works with
relative,
you.
right? No
Yeah,
one, no relative on
because sometimes they don't want to. Yeah,
Medford.
yeah, sometimes the tech is it's like Philippines too. I've been here for 20 years. Okay, I'm just asking you to help me with the vitals. Good thing vitals are electronic. But it's hard. It's a lot of work because you got to situate patients. They can complain about you. They can put you in TikTok, Google review, get your name, find you in the database, report you to the nursing
Support
board,
you.
report you to the
Yeah.
patient advocate for
Mhm.
something like just because you didn't help them sit up, or probably just because you didn't answer the call bell because you're resuscitating someone the other door. So something like that. The stress is real. Like for patients,
Correct.
but it feels like, whew, why do I feel I'm so stressed every night I go to work? So something like that.
yeah. And for honestly, for me, Sir Paul, when I moved here, that during the time I had the 8 to 10 patient, it wasn't that bad for me. Compared when I was working in Singapore, I also had 10 patients during the nighttime, 10 to 11. I was like drop dead, sweating at the end of the shift. So that's how
That
bad.
gorgeous, right?
Yeah.
That gorgeous.
Yes, sweating, gorgeous. So that's how bad my routine was in Singapore. But when I moved
Mm,
here in the US, even though it's 10, I felt sleepy most of the night shift, which is weird. It wasn't as busy, but
yeah.
but that was given because I had a, let's say, a more difficult experience before that. But for those who did not have that kind of experience, 10
Yeah.
will be super super overwhelming. Okay,
Yeah,
so
Mhm.
that's true.
I would really suggest no. Okay, that's one thing. So
Yeah.
filter is the key word.
And probably perhaps there's also it's also different per workplace, because I've seen some nurses accept a job to, for example, level one facilities.
Yeah.
Oh.
I'm 37, one, and Anna. I feel like for me, if I'm 21, 22, I'm new to nursing and I want to go ER, I want to learn in level one. You know what I mean?
Yeah.
But we
Mm-hmm.
know how bad it is or how busy it is, right? Because I worked at level three, level two, and I'm like, I'm gonna stay in my freestanding ER. Level two is gonna be my PRN. I don't want to be full
Yeah.
time there because you're full time. Oh my God, you're gonna get so exhausted. But then months later, we would see them quitting their jobs and finding somewhere else because
Mm-hmm.
it's not as what they expected. Because when you work in high acuity academic facilities, you have to remember
Mm-hmm.
all sick patients from surrounding counties and neighboring states will be flown there.
Coming. Yep.
So
Mm-hmm.
for me in ER, I work ER, I work trauma, but when I worked in higher level facilities, now I get A-line patients, patients on all these
Mm-hmm.
devices coming in from other hospital that needs to go to our ICU, but because ICU is full, I'm that nurse who will take care of this patient. That's for me, there are, we all have our limitations. So I'm like, this is too busy. I feel like someone's really gonna die on my shift all the time. Like, please not try not to die, all right? Because I'm still with another patient. Please wait for me.
Not today.
I'm always on my
Prayers.
toes. So it's overwhelming sometimes when with different facilities because I've also had facilities that are really good,
True.
like regular pace. It's busy, but it's not like I'm running around and exhausted
Crazy.
all the
Yep.
time. Yeah, something like that.
Mm-hmm.
So I think it also matters as to where you work. Because
Mhm,
if
mhm.
you work in a non-academic facility, semi-rural, semi-urban, perhaps better than when you work in academic facilities. So it's not
Yeah.
all, like, oh, I want to work in a level one facility, Johns Hopkins.
Mm-hmm.
Oh my God, we have a special guest in the background is getting set up. I
Who
see
is
him because
that
I have the admin
special
tab.
guest?
We're gonna bring him in because template of nurse patient ratio is California, so we need a
Yes.
California nurse here.
California nurse.
Yep, I think it's getting set up right now. So admin moderator will work with him until he can get in. But Nurse Marvin is in the background.
Yo.
Woohoo!
Oh.
Hi everyone.
Hi
Hi everyone.
Marvin.
Hi. Good morning. Or good evening here in Zamboanga City. Currently, right now, I'm in the Philippines. So please bear with me because I don't know whether there might be power interruptions.
Yep,
It's
yep, yep.
fun in the Philippines. More fun.
Right, right,
Good
Yes.
thing,
right.
Sir
Yeah,
Marvin.
it's
Buenos
more fun in the
dias.
Philippines. Buenos dias, Nurse Paul, Nurse Paul, Nurse Juan, and Anna. Buenos dias, buenas noches, buenas noches.
Hey,
Buenos
we miss
dias.
Hi.
you. Dear
Buenos
Marvin,
dias,
we miss
amigo.
you.
Yep. Marvin, we're in the
I
middle
mean,
of
we miss you also.
talking about We're in the middle of talking
Yes.
about nurse patient ratio. So I think it's very timely for us to talk about it because you're
Mm-hmm.
here and you can also give us insights from California. So we have Anna from East Coast working
Yeah.
OR and nursing home. We have Nurse One
Mm-hmm.
working floors. In the Midwest, you have me, ER in the South, and Marvin, ER in the West Coast. Woohoo!
Yes.
I think we
So,
got we
mhm,
got every
yes.
region covered.
Mhm.
Anyway, why is it
Yes.
why is it important to talk about nurse patient ratio? One was sharing something earlier about being prepared before coming over here because it's not what
Yeah.
what you think. Like you still have to have bedside experience. At least when you get over here, you feel like it's a little easier versus you're learning your skills here because you didn't have
True.
bedside experience. Anna, how important is nurse patient ratio?
Since when I work in a nursing home, I have no experience at all in a nursing home. So when I had my interview when I was in the Philippines, the nursing home hiring me, I asked that because I know in myself I have no experience. So I want to know how many patients I will take care of. And they told me if you're gonna work in the morning, you have a lesser patient, like one nurse is to five in a nursing home, a graduate nursing home. But when you work night, you will have seven or eight patients at night. So it's very important. At least I can I know what I'm expecting for. I know what number for how many kids or residents I will take care of. Because it's a whole new role from OR and then they assign me in a nursing home. So it's very important to know that. And at the same time, I will know how to, balance the time. So because I know in myself, I have no floor experience. So that was my number one question. There's one, when they interviewed me, because like what I said, all my career in the Philippines for 12 years, I worked in the OR. So please don't be shy during your interview. Ask that how many patients or nurse patient ratio if I'm gonna work in a nursing home, in a hospital. Do not be overwhelmed. Do not be blinded by, oh, you're getting paid X amount per hour. Be smart, future nurses.
Mhm.
Right, for
And
Marvin?
And Marvin, how is it important for us to talk about nurse-patient ratio? Since you also work in Texas and now you moved to California, how important
Mm-hmm.
it is for us to talk about nurse-patient ratio, especially for our immigrant nurses coming over here or are new here in the States and are listening to us right now?
All right. So when you say patient nurse patient ratio, we also deal with staff ratio. So it is very important for us to discuss because we are dealing with life. So again, we are not Superman, we're not Wonder Woman, we're not Darna. So we're not here like in the Philippines, like if one is to the entire world. So I remember before
Correct,
when I
correct.
used to work in the Philippines. So when I was assigned to the entire ward, so some of the wards are very easy because some of the patients are walkie-talkie. But how about if you are into like a very sick, like ER and also like ICU, and
Mm-hmm.
even now, I've been to some of the hospitals. Like I visit them. There's no staff ratio or there's no safe patient ratio. Again, we're dealing with quality care. Number one, patient
Mhm.
safety. So because like if you have limited resources, like limited manpower, for sure you cannot equally divide your time with all those patients depending on their acuity. So remember, you have only one license, and when you have like every patient has only one life. So if you miss something important based from your assessment, you fail to give this one, then definitely something might happen, and for sure you might be risking your license. Now, when after transitioning to the Middle East, we have ratio, but sometimes it can be flex enough, even though your acuity is so high still they're not following it. So when I came to the US, I was really shocked, especially when I came in Texas. In the ER, was 1:4, but sometimes if you have ICU patients, it's 1:2. But it's not. I mean, it really depends on the charge nurse. It's not legally mandated, but in the California, most of the California hospitals are governed by union, and the union dictates safety. So in our ER, regular patient, one nurse is to four patients. Or if, for example, you had a very sick patient that turns to be ICU, then definitely that's 1:2. Actual trauma resuscitation is 1:1. Actual stroke resuscitation is 1:1. Also, there's what we call like what do you call it performance basis, or depending on the resources needed. Like if you need to have an eye drop every 5 minutes, because some of the eye drops are like 5 minutes and we have three medications, that 1:1. It's also based on skills. Now will only become 1:2, it become ICU, and then if it's not any more trauma, there's no resuscitation present. But it really helped me to give quality care, and it also boosts my confidence because like I know in the midst of chaos, there are things that you can control. Now at any time you become out of ratio, we file ADO or in harbor in some of the states because like it's your right. Again, you have only one license, you need to protect it. And patient has only one life. Make sure, guys, that you have the available resources that you need and also safe ratio. Don't be a Superman, don't be a Wonder Woman here because like you can only save much. All right. So that's
Right.
for me in here
Right.
in California.
Thank you so much. How about you, nurse one? How many nurses? I mean, patients do they give to you, and what happens, or what do you do, or what could you do if they're giving you more, or even if it's maxed out with your ratio, but the acuity is difficult to where you need to be in one patient or something like that. What are the steps that you take?
Okay. So far for me, Sir Paul, for the last four hospitals I work here, even though it's like if I'm already maxed with the patient, they don't normally give us an extra patient. So usually they defer it to someone somewhere else. But if I am have a scenario wherein there's a really difficult patient, I most likely coordinate with a charge nurse. We typically have a charge nurse that can handle or aid you during those time. And I will tell them, frankly, that I'm busy. I have to focus on this. So if you don't mind, just help me with a little bit with other patients or with this kind of patient, just to just to provide a proper care, because it is what it is. Sometimes some nights are really bad, especially if someone is like getting to the point wherein they need to be transferred to the ICU or PCU, but they're still in the midst of working for it. So you definitely have to focus on your patient, and some of the other patients will be left behind a little bit. Okay,
Right,
so
right.
that's where teamwork comes in. So when that happens, having good team members or colleagues will really mean a lot. Okay, so that's why having good relationship in your work place is also an important thing. Okay.
Yeah.
So try not to burn any bridges. Okay, guys. So try not to,
True.
especially like if for Filipinos coming to the US, we try not to bring our Filipino kind of nursing way, wherein like katoxican or yung during endorsement, it's like, why you not never do this? Why you never do this? Or you have to do this before you go home. So that's
Mm-hmm.
one of the typical ways wherein I've noticed for new nurses here in the floors, wherein they get isolated, or the nurses here, they tend to stay away from them because of that kind of mentality,
Mm.
or
Yeah.
how we were raised back home. So
Yeah.
yeah,
Yeah.
so yeah,
Seniority.
yes. So just coordinate, and like what Sir Marvin said, don't be a hero. Okay,
Yep.
you really have to maximize your resources when taking care of our patients, because lawsuit is always just there, just waiting. Okay,
Yeah,
and
I'm
you'll
just
never
waiting.
know. Sometimes you'll just realize that someone complained about you a week or 2 weeks after, and so that's not a good scenario for you, really. So just do your best and try to coordinate things to help everything for you and
Right.
your patient.
Correct. How about you, Anna? What was your experience about nurse-patient ratio? How many patients do you handle? We know your OR or in your nursing home practice, but and what also could you do if the nurse-patient ratio is to, not what you're expecting? Suddenly they're giving you two or three patients.
So I experienced what Nurse One was saying about the Filipino type of endorsement. So like what I said, when I arrived in New York, they assigned me in a nursing home, or the exact right nursing home, and that's a whole new experience for me. I worked night, so they assigned me 8 patients, and mind you, these residents are from newborn to 18-year-old. So sometimes I have a patient in nursery like babies. They have hydrocephalus, they have a lot of congenital defects, and then I also have another patient outside who are like 13-year-old up to 18. So it was really hard for me during those times. I don't know about nurse facial. I was shy. I want to be a team player. I don't want to be accused of you're not being a team player. You're not being a helpful. I thought all Filipino nurses are good, and I was like, yes, but you're giving me 8 patients, and it's supposed to be only 6 every night because some of them have ventilators. So, I mean, in ICU, you're only allowed two, right? I have no experience in ICU, but my husband used to work in ICU. So, during those 1.5 years working in a nursing home, it was rough because of the nurse ratio, especially when someone called out and go on a ward. So, the worst assignment that I got was 1:10. And I almost quit, but I said, don't quit, don't quit. I have 1 more month left before my contract ends. So now that I went back to my first love, which is OR, I am blessed. I am saved. I only have 1:1 room. But when I was in the Philippines, guys, I was assigned 3 rooms. OR1, a counting instrument. OR2, I'm securing the specimen. OR3, I was prepping. Here in US, that is not allowed. If you're an OR nurse, which I believe, I want to be biased, right, May? OR is the best area because you only work in one room. One-on-one patient care, you're only assigned in room one. If you have 5 cases, that's it. So I am blessed in the OR, but at one point I was pulled out in labor and delivery, and they wanted to give me like 4 to 5. I was like, hell no.
No.
Those are women who are pregnant, their hormones are up to my height or higher than my height. So I said no. The way the way I approach it, I talked to my partners, I told them, and we have union. Most of the hospitals in New York have union, but they are not like in California, for Marvin is the most blessed of them all. So sometimes it happens that even if we have union, our nurse to patient ratio are still out of the same one. So for Marvin, you call it harbor, right? Here we call it unpaid staffing document. So that's what we file, and you just keep filing it. Currently in the hospital that I am working right now, we're having a lot of issue in medical surgical, in telemetry. We have no tech. I almost got pulled up the other night to be a tech in Florida. I was like, hey, we're trauma hospital. What if I have a trauma? You're gonna pull me back in? They only have 2 nurses, and one of them have 11 patients. And mind you, we're union hospital. So we are on the verge of, you know what I meant. So those
Strike.
are my experience.
Yeah, with me in Texas, Marvin practiced here too. We don't
Yeah,
have mandated ratio,
yeah, we
but
don't have.
we don't have it. We have 1:4, which is the accepted ratio. It's not mandated, which means your a hospital can blow past 4 anytime. If we say, well, we talked about 1:4, there's no law. I'll give you a fifth one, right? When we do
Mm-hmm.
fast track, we do 1:6. Depending on the facility, I've worked in semi-urban, semi-rural, or critical access hospital. We could be 1:4, even if one patient just ROST or ICU intubated. We could be 1:4 because there's not a lot of nurses. Staffing
Mm-hmm.
shortage is real. But I worked in bigger hospitals here in Houston too, where um, we get 1:1, just like with Marvin, for stroke or for higher acuity patients like trauma level 1 or something like that. But again, it all boils down to staffing shortage. But we don't have a mandate. We do have and I've used it multiple times. Uh, thank the Lord for that. It's called Harbor, Safe
Safe harbor.
Harbor.
Safe harbor.
So I think
Yeah,
we're,
safe harbor.
yeah,
Yeah.
I think we're only one of the few states with a board of nursing mandate or law
Yeah.
for safe
Mhm.
harbor. So safe harbor allows you to, if for example, two ways. If you're given orders to where you're not comfortable doing it, or you think it's not safe for a patient, but the provider is forcing you to do it, safe harbor. And the other one is for staffing ratio. All right. And let me tell you
Mhm.
right now, it's super effective because it's a board of nursing law. You can fax the report to the board of nursing. Your
Yeah.
hospital is required to do something about it. So one time they gave us 1:7 in a crazy staffing shortage. Our manager didn't do anything about. He knows that 2 nurses are going to call off because weekends, especially in the especially
Yeah.
with when you're working with baby nurses, sometimes they love to party on the weekends, and it's always us
Friday,
that's like
Saturday.
35, 40 years old that are working weekends, because where's our baby nurses? They're out partying.
Yeah.
They could be in the as a patient when they're drunk. I'm just kidding. But the point is, we always know when it's a weekend, you need to have coverage because people call in all the time. Well, guess what? One Sunday morning, 3 of us came in. Charge nurse, 2 nurses, that's me and the other nurse. That's including triage. So one charge nurse, one triage nurse, one ER nurse, and we have a packed ER, 15 patients on the bed, small ER, and probably 30 in the lobby. Well, what did we do in the first hour? Safe harbor. And of course, our manager and director showed up. They're nurses again. They're on the floor, and
Mhm.
they were forced to come in on a Sunday. But I mean, stuff like that. Not many states have that advantage, right? I'm looking
Mhm.
at nursejournal.org right now, and guys, I've noticed that there's only few states with mandated staff ratios, right? or nursing patient ratios. Example, Oregon,
Mhm.
California, New York just passed it in 2021, Oregon
Oh,
in 2024, California in 2004. Guys, we are 20 years behind
advanced.
California. Good thing I have California
Sure, winner
license. I'm about
talaga.
to, yeah, benta ko na yung bahay ko dito sa Houston. Lipat ako sa
Let's move to
California.
California.
New York,
Yeah,
yeah.
to sunny California. No?
Yeah, Massachusetts, always sunny, not like here in Houston. Huh? Massachusetts
Yeah.
passed it in 2014. Wow, Massachusetts doing the right thing. Other states with pending legislation now: PA, Pennsylvania, Georgia, Maine, Illinois. I worked in Chicago. We didn't have ratios when I was there. Illinois, New Jersey. Um, that's it. Sad story, right? And I see Nurse
Yeah.
One showing the National Nurses United advocacy for mandated national
Mhm.
ratio. Can we show that
Yeah.
picture?
Sure, sure.
Because this is based in California, right? And
Mhm. Yes,
yeah,
that is
I
based in
might have
California.
copy as well.
Okay.
Yeah, what do you think
Yeah.
about this, guys? What do you think about this? Why are only like few states having this mandated ratio, and why is it important to do mandated ratios? Anna, we can't hear you.
Oh, it's very important because, aside from the safety of the client or the patient, or all of us nurses, so we're not gonna be burned out. I mean, I know we're earning per
Yes.
hour here, but our mental and physical health are the priority because how are you gonna also use that hard-earned money if you're sick,
Mhm.
right?
Yeah,
Yes.
So it's not just all about the patient, not all about your license, but also your mental and your physical state because
Yeah.
we're not getting young.
yeah. And actually, Marvin said something very important earlier that what
Yes.
happens when you don't have correct ratio, patient's
Yeah.
safety could
So
suffer.
it yeah, patient safety, because like again, so patient ratio or nurse staffing ratio is actually like double-edged sword. It affects not only the nurses but most importantly your patient. So again, there are a lot of, like, as what nurse one was saying, the common reasons why our nurses are getting sued is number one, failure to monitor. If you have like 30 in the lobby, how can you monitor them? Next, the
Exactly.
next one, the next thing that the nurses are getting sued is failure to give intervention on a timely manner. If you have 30 if you have like two ICU patients and you don't know the other one is stroking and you're doing CPR on the other, like, of course, like, you only can save one. And then the other instance that the nurse can actually get sued is aside from getting is like relaying important lab results. So if you are not, because like there's a rule in California that once you receive a critical result, you have to inform your doctor about it within an hour. And then if you fail to do it or give intervention about it, then so every time lapse is increase of mortality.
Yes,
So
true.
so and also I want to emphasize this, especially for non-ER. So if your unit is on max capacity, like for example, if you're med surge, if you only cater for 16 patients, I know your unit is already closed.
Mhm.
But for emergency, we are not. Even though like
Yeah,
our
we're
capacity is
open.
only, but we're still open
Yeah.
24/7. And also, I just
Yeah,
want you guys to understand us, that especially if we have mass casualty, so we will entertain all those
Yeah.
patients and we will be
Can't
actually
everybody.
say no.
why
That
we
that
are we're
that's
always
the
like
problem
filing.
with ER.
Yeah.
Exactly. So again, we are trying to be superheroes and all that, but again, we only have one body and we only have limitations. And our physical strength, we're not, as what Anna was saying, we're not turning any younger. So that's why we
Mm-hmm.
filed this again, assignment despite objections. So we there's like an online form for us, and then we send it to our union, and the management will be responsible for that. So if you think
Yeah,
that if your gut is telling you that it is not safe for you to practice, knowing that you cannot monitor everyone,
yeah.
like anyone
That's
can die at any
that's
instance.
ER
Oh my
for
god,
you.
exactly. So it's patient safety is the number one priority. That's why if you guys are not comfortable, like, inform your charge nurse or do an ADO, do a harbor or whatever your state legally mandates you to do, especially if the staffing is wild and crazy.
And
Yeah.
yes, in ER, you cannot close a unit. You cannot like in
Nope.
bed for we're full, no bed
Yep.
available, and you
No
Yes.
cannot
max.
really turn.
Yeah, we
Yeah,
have
you
patient
cannot
loads
really
too.
turn away your patient because of
Yeah.
your right? So
EMTALA,
I think.
EMTALA violation. Yep,
Mm,
we can't
Yes.
refuse patients until they're medically screened, which
Weird. Yeah.
means
mm,
the providers, NPs, PAs, or doctors have assessed they're not emergency. But guys,
Right.
we're open the whole
Yeah.
time,
All
regardless
right.
if there's like a mass casualty around, somebody's
Yeah.
shooting around, like there's a
Yes.
disaster, there's a hurricane, there's flood. ER is
mm.
open. So yes, I'm sorry, but if there's an empty bed there, we're gonna bring the patient up
In the
because
hallway.
we need the
Yeah.
bed.
Go
Yeah,
away.
that's the
Go
truth
away.
though. It's stressful in the ER because imagine, Marvin, we have to take care of prego patients that couldn't go to
Yes.
L&D. We have to take care of ICU patients, CCU
Mm.
patients. In my case, I even had to handle CVICU patients. I'm not even CVICU
Wow.
trained. I would not be comfortable in CVICU because I mean, these patients are very like critical, like very high acuity, more than my level of what's this I feel like more than the level of my capability, but it's scary. So what do you guys think about where we're looking at the screen? This is what Nurse One's photo is all about.
Mm.
Yeah. This is like a dream for
Mm-hmm.
some
Yes,
hospitals. Dream for
Mm-hmm.
some hospitals, but
Mm-hmm.
true for
we're still
some. Yeah.
dreaming about it.
Yeah.
Heaven.
Yeah. This is
Oh
But
yeah.
in
ideal
OR, it's
in the
happening. In
perfect
OR,
world.
I'm living my dream.
Yeah.
Oh, we
Exactly. In
have
our
five.
ER, we're living our dream. Yeah.
I
But
think
I
I'm
don't
in
know.
the wrong specialty and in the wrong state.
Yeah.
For me, working in med surge, 1:4. Have one hospital we're in. The average is like 4:5. It's in
Mm-hmm.
Kentucky still. It was like one of the best
Ooh,
experience for me. It's like a really
yeah,
nice thing. And we had the aides and we had the charge nurses. So four was like a blessing. Okay, so
right.
the only thing is I left the hospital. I left the place is because the rate went down for the travel nurses. But if given a chance, the rate will be back. I will hop on to that kind of ratio anytime.
Have you
Right,
tried
right.
Mm.
Nurse One? Have you tried California?
Um, Sir Marv,
Yes.
after yeah, after during my first contract here with a staffing agency, I tried to buy
Uh-huh.
out because I was planning to go to California during the
Yeah.
COVID time. But
Uh-huh.
I got my
They're still
manager,
opening.
but my manager for that connect. So for that agency was was a little bit an a-hole per se. So we got into fight and I wanted to buy my contract out. I want to get a lawyer, but it was during a time of COVID, so it was it was difficult for me. So I wish I just pursued in doing and just move into California then.
I have
So
license for California. You too, right? Or there's
yes,
all.
yes.
Active. All of us
Mhm.
have active California license.
How
We're
about
just
there's
waiting for
one?
Marvin. Marvin, I just
Yeah.
updated my CV. I'm sending it to you now.
I'm still might move to California, but I'm prioritizing something else for now. So
Yeah,
Mm,
maybe in
okay.
the future, then I might move. But
yeah,
we'll see how life and future unfolds day by
yeah.
day.
I think
Guys,
we'll.
We'll see.
I just want to share Pay's experience. In her
Yes.
experience in New York rehab, 1:40 night shift. 1:60 for 90. Oh my God,
Right.
Pay. I'm happy you're out of there.
That's a lot for
And yeah.
is
Mm-hmm.
this what is this? Oh, outpatient rehab. Yeah, that's why we get those patients in ER, right?
Mm-hmm.
And they said, "Oh, they just had fever today and they have pneumonia." Well, I'm pretty sure that's been a pneumonia for 3 days because the
Yeah.
patient is like septic, map
Mhm.
is like 50. That's not this morning.
Oh, there's
So,
one question. There's one comment here from Jorly Jabonete. She
yes,
said
yes.
that she has a contract in Missouri. It's 1:6 that she's gonna go to, and she said it won't be an issue for her because she's used to having 1:10 for 12 years. I'm not sure which place,
Wow.
but it really depends. Really, sometimes one out of six, 1 to 6 in some hospital is heavy. Some it will be an easy peasy. So
Right, right.
and also depends on your experience as well. But having 12 years, most likely it will be an easy job for you.
Yeah.
Yeah, my
So
question is that floor or PCU or because if it's
Oh yeah.
PCU, it's
Oh
like
yeah.
step down, right? So it's
For
still
sure. Yeah.
busy.
Mm-hmm.
Mhm.
Because if that's PCU, they could have drips in there. So six is
yeah,
still a lot.
A lot.
yeah,
Yeah,
there's a lot.
yeah.
So by the way,
So
guys, sorry,
clarify.
sorry about the power interruption earlier. So
Really.
yeah,
Relax, it's
but
Velocity.
back quickly. So going back to the California thing. So you guys are still welcome to join me here in California, especially for those hospitals. So I just want to tell you a story regarding our travelers. So our facility, they consider it as a very travel friendly hospital. So if I have given the chance to like precept a travel nurse, so usually about 3 days, so they always like shocked because some of them are coming from the southern, from the eastern states. So they said like, oh, you have 3 breaks, and then like every 4 hours you need to go on break like uninterrupted. Like, yeah, we have to get your food.
Wow.
And then like, oh, I have an ICU patient
Break?
here.
What is that?
Yeah, and then I have an ICU patient here. Oh, that's 1:2. Like, what? Really? 1:2? Even though like my patient is like a soft ICU. I said like, regardless whether it's a soft or a hard ICU is ICU. So it's in
Correct.
a mandate. Like what? And then they said like, oh, I have this like a stroke code. Don't worry, there's a lot of resources. Like, she was shocked. Like, oh, how come I have the neuro here? I have like the pharmacist here. I have this team over here. I have my
Mm.
techs. I have another RN. I said like, wow, really? You have this? I was like, yeah. So your focus would be like patient care, documentation. I said, wow. So most of the time, especially when they're very good travel nurses, they sign up. So if you're going to
Mhm.
check the number of travel nurses who became staff in our facility is like 40%. So and right now most of them are still there, and then our retention rate is still very very good. That's the reason why California is one of the best states for nurses, because number one, we try to as much as possible provide safety among staff, because if you secure staff safety, for sure your patient safety is never at risk. Yeah, that's welcome,
Mhm.
guys. I know you have California licenses, just try.
Right,
Sana
right,
oil.
right.
Sana oil ka na lang. Sana
I
oil.
know,
That's
I know.
our backup
Yeah,
plan for Mark.
yeah. I know.
Just try,
Yeah.
guys. I mean, it's never too late. It's never too late. I know I have already tried to influence Paul. I talked to him and also
Multiple
my friends
times.
here
Yes, I
from
was gonna
California.
say.
Yeah, and then there are opportunities also for you, Nurse One, and also Miss Anna, if
Mhm.
you really want. So just try, and then like if you don't like it, you can go back to your previous facility. But for sure,
Yep,
you're gonna
yep.
extend
Nobody wants to
once you
go back once they're in
yeah,
California.
once you're
Because
able to
that's
get the
the best
California gold.
nursing. Yeah,
Yeah,
yeah. And to be honest with you guys, I think this is gonna be my advice, because the only reason why Marvin invited me multiple times, and I would really, really love to actually have California license, but the only reason why I'm still here is because I bought a house here. So, guys, this is my advice: don't buy a
Do not
house if
buy a
you're not
house.
sure where you want to go. All right. What I want
yeah,
to say: try everything first. Like what
yes.
Nurse One is doing. He's traveling, so he has more flexibility. It's hard when you're already tied down in one state. I think
True.
for you, buy a house when you're 5 to 10 years in, right?
Mhm.
When you're more settled. Because if you're new in the
Yeah, look
states,
at me. I waited
yeah,
9 years to buy a house. So I was
yeah,
like, maybe this
you're
is it.
yeah, because have to have a certain level of maturity. Plus, when you have a house, it's difficult to move around already, right?
That's
But
true.
but hello, we're still young. I can fly to California anytime I want. So that's the thing. So I can still go to California and practice as a nurse. So we can share more
Yeah.
in
Yeah.
DNP Unlocked.
So
Right.
we have a comment here from Miss Lorena Malanog, and she
Yep.
said
Yep.
like, "Fake, like, haha, Doctor Nurse Paul again." So like, to be honest, when I used to work in Texas, sometimes I don't. Luckily, if you have a break,
Uh-huh.
because like, yeah, but in California, it's mandated. So if you
Yep.
did not receive your break, for example, the first 30 minutes that you need to clock in and clock out, that's equivalent to 1 hour. And then
Mm.
they can actually like trace it from the what do you call it? You have to sign a logbook that you were not able to get your breaks, and then they will give you that as double time. And then the management will ask you like, "Hey, what happened?" It's not punitive.
Double time.
Yeah, it's not punitive. It's not. You're just asking you like what went wrong. Yeah, it's double time because it's more than 12 hours. So
Yeah, I'm about to
uh,
call the Texas
Wow.
Board of
yeah,
Nursing
yeah,
to
exactly.
start writing
So
this down.
yeah, exactly. So I mean, if you missed your break, especially the first 4 hours, so that's already like a meal penalty, and then that will be equivalent to 1 hour extra time or double time on your pay. But you have to, I mean, some of the management will ask you what's the reason. Again, that's not punitive. They just want to ask the entire picture why you have not gone on your break, because like missing your break in California is very, very big deal compared
because
before
it's
when
a
I used to
law.
work somewhere else. Yes, it's a law
Mm-hmm.
because like before it's not like we're eating while we're in triage. So I said like, why are
Yeah.
we doing this? And then somebody said, oh, we have a break, and yeah. So please, in California, it's mandated for you to get all your breaks, or else your facility will be penalized.
Yeah.
Yeah,
So
and also
that's true.
yeah,
It's
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 true.
it's a law in California that they are required to give breaks for
Yeah,
nurses. I think
that's
for
true.
workers who's working at least 8 hours and at least 12 hours. So since we have
Yeah.
12 hour shift, they have mandated breaks. In
So
Texas, it's not mandated. It's suggested. So
suggested.
you can, if you want to give your nurses breaks, you
Yeah,
can, but you
yeah,
really don't have to.
exactly. So
It's
when I used to work
suggestion.
so when I used to work in Texas, you have a buddy. So he has four
Yeah,
patients.
yeah,
I
yeah.
have my
True.
four patients.
That's
They
what we
always said,
do.
"No, break each other, break each other." As a like, oh,
Yeah.
I have to take care of his patients for 30 minutes, so I have eight. So you're out of ratio. So say for example, you
Yes.
have an
Uh-huh.
ICU, and then like,
That's
oh,
the
I'm going
truth.
for a break. I said like, oh, and then like when he comes back, I said like, why you did not carry out some of my orders? So it will start risk
It's
of like what do you call it, like uh rivalry between you and your coworker because you didn't
Yeah.
do anything for your patient for his patient.
correct.
Now,
So
going
yeah,
back to
true.
yeah, for question of Miss Lorena. So she said that she has a friend who sometimes assign as breaker. Yes, that is true. So for us
Mm-hmm.
senior nurses,
Yeah.
I'm only assigned as a breaker RN. So in every two RNs, like in every two nurses, there's one breaker RN. So we call it throughput. So it must be a senior nurse making sure that the
Mm-hmm.
patient flow is continuous, and also you provide breaks to them every 4 hours. So yeah, you have
Wow.
phones, yes. So that's my role. So I have only lesser patient care. So I only get there, and then I'm going to check every chart, making sure that there is nothing skipped, or there's nothing neglected on this
Myth
particular
or
patient.
work. Mm-hmm.
Yes, or missed or something like that. So that's my role as a breaker nurse, or a resource nurse, or a throughput nurse. So
Yep.
every 4 hours you only, and then you have your timer break. So I'll just put a paper, what time do you want to go on break, what time do you want to break, and then
Mm-hmm.
like sometimes they are shocked. I said like, oh, do you want me to give your medication for this patient? And they said like, really? And how did you know? And I told them like, oh, I already read the notes of the patient or the chart, so can I give it so we can be efficient? Yeah, and
Yeah.
that actually really helps. So being the third nurse among your group is actually a lifesaver for some of us, because you will see it, making sure that nothing is missed, make sure that everything is provided, and you have another set of eyes to make sure that everyone is alive and well.
Yes. Yeah.
Mm-hmm.
Let me
Alive
let me
and
tell you
well.
guys this.
Alive and
I
well.
know nursing forums. We've talked about HEA, how it's a for-profit. There are bad and good. Let me tell you this. I've experienced something similar here in Texas, and it's such a good dynamic where I'm a float nurse. I come in 9 a.m. or 10 a.m. or 11 a.m., right? And all I gotta do is break nurses. I don't actually get my patients till around 4 or 5 because that's when all
Mm-hmm.
the breaks finish. There are, like, for example, 6 to 8 primary nurses plus the charge nurse. So what I do when I come in, I'd start breaking nurses, right? 30-minute block. So for me, that was one of the best experiences that I've had as an ER nurse here in Texas. So it isn't that bad because yes, we don't have mandates, but because there's safe nursing ratios, they want to follow the ratio, right? So what happens is I started a shift, same thing. Charge nurse says, "What time do you want to go to shift? Who wants to take the 9 a.m. block, 9:30 block, 10?" So
Mm-hmm.
the float nurses are gonna come in at 9 a.m. start breaking nurses. So that's for me one of the most efficient ERs that I've worked at. We see very busy. It's a very busy volume, 200,000 a year. Can you imagine? We see like 200 in a day, 200, and we're like a 30-bed ER. We're level three, but because it's the Rio Grande Valley at that time, level three is the highest. We're like level one. I'm gonna tell you right now, the level three is just in the paper, but because
Yeah.
our nearest level one is San Antonio, and Houston with the
Can I
S.
2 hours
tell you?
away. 2 hours away.
So we are it. You know what I mean? We are it. We have to stabilize patients. So it can get crazy, but we have float nurses too. But then again, I like what California did because there's laws, right? So earlier we talked about how we can improve patient safety with nurse patient ratio. Now let's shift the perspective to us nurses. We've all worked in places where we've experienced bad ratios to where, oh, I don't want to work here anymore. But we've also experienced places where great ratios. We have great ratios, like what Nurse One was saying earlier. I want to come back here if they're gonna give me opportunity. And Marvin is like, I want to stay here in California because of that ratio. And Anna is like, I'm gonna stay in the OR because I'm 1:1 versus the rehab. So, what is the effect of good and bad ratio to us nurses? Let's shift the perspective to us as nurses, mental health, physical health, and all that. Let's start with Nurse Anna.
So what is the good and bad effects of nurse patient ratio? So from working in a nursing home, the good and bad. The good will be I tend to be more careful and I acquire my personal malpractice insurance.
Yes, me too. I'm like, they say malpractice insurance. And somebody told me, one of the classes I attended says it's not who will sue you. It's not when are you going to be sued, because
Yes.
definitely
Yes.
somebody will. You know what I mean? So that's the crazy part. So I was like, I know it's 1:4. It feels good by numbers, but let me get my malpractice insurance.
So I think that's the best thing that made me really the good and the bad of the nurse patient ratio. When I was in a nursing home, meanwhile when I went back to OR, there's not some bad. It's all good, because one is the one who can beat that when you work in the OR. But when I was in a nursing home, I tend to be more careful, be more alert, because I was scared. I mean, this is not my earth. It throw me a level 1 trauma hospital OR. I can do it, I can manage it. But if you're gonna throw me in a nursing home wherein I have no floor experience when I was in the Philippines, my anxiety, my stress was 11 out of 10. And like what I said, I made sure that my malpractice is always reviewed annually, automatically. That's how scared I was. And then I always follow the protocol policy, like by the book. I'm not saying that I will follow the policy by the book now that I work in the OR, but what I'm trying to say is because I was so scared getting sued, I was so scared for the patient or something happened back to them. That's how I was working during those times. So in return, I was stressed. I don't even want to go to work. I experienced almost want to cry when I was clocking in because this is not my area. This is not my. But then again, I was in a contract before. Thank God I was able to finish it in 1.5 years because I worked 80 to 100 hours. My agency let me finish it because I was asked beyond. My contract was 3 years, equivalent to 5,000 hours, and I worked more than 5,000 hours. So I think that's what can I share for you guys. How about you guys?
Nurse One.
Mm.
What's the effect of nurse patient ratio to you as a nurse? You've worked in good hospitals and bad hospitals with bad
Mm-hmm.
ratios.
Okay. So definitely the tiring part and less overtime. If it's the ratio so high, feels like you don't want to do any overtime. So less
Yes.
money definitely. It's
That's
like
true. That's true.
never mind. I'll just rest.
No.
No. So also, like I said, mental stress, of course, is always there. Sometimes you might not realize, but your body is the one like telling you is you're already tired. I
Yeah.
really feel sometimes on my first hospital we're in, I overslept. Sometimes coming to work, and me and my wife together will be overslept, and I'll be coming in late, maybe like an hour late or something like that. So that was a difficult thing for me then. But honestly, the only good thing for me is I had worse experience back in Singapore, like acuity wise. So it was easier for me here. But of course, after working in other hospitals here, I felt like I should have like just hop onto a better hospital then.
Mm-hmm.
Would have made my life better. Not
Right.
as close at as California level, but better, better level in a way.
Right.
So,
Right.
yeah. Hmm.
How about you, Marvin? Because you've worked in Texas and then you moved to
Yes.
California. What's the
Mhm.
impact to you as a nurse?
So even when I work in the Philippines and in the Middle East, so there's also like a like impact emotionally, physically to my health. So here, this I think if I'm going to give my 2 cents regarding this question, so the first thing that I want to say is when you don't have patient ratio, you are very risk of having medical errors. To be honest, medical errors because like again, um, this results in inattention, decline in vigilance, poor judgment, and lack of concentration. Also, because of because of this, as what Nurse Juan and Nurse Anna was saying, it will increase your risk for burnout. Now, it's a domino effect. So once you're
Mm-hmm.
burnt out and you are in litigation, I remember a time that I'm not a perfect nurse. Again, I'm not a perfect nurse. So there was a time that I was like one is to the entire ward. So I missed something like this. I missed giving this one, and then when I was asked by the charge nurse, why you didn't give this? Why did you wasn't given on time? I said like I'm the only one during the night. I have the entire floor, and then we have a code on the other one that I need to help. Of course, like I need to help them because they don't lack resources. And then it was reprimanded. It was instead of like praising me like, hey, you did a good job and
Mm-hmm.
in making sure that everything is like um, everything is prepared for the next
Right.
day. But I ended up going to the principal's office and reprimanded because I missed giving this particular antibiotic. I said, God dang it. And then my morale was very low. And then same thing in the Middle East because like sometimes I'm not dropping names. They have gangs in there, like mafia of this side, mafia of this side. If you don't
Oh
belong in the
no.
other mafia, that's already like that's another challenge. So of course, when I was new, because like they lack staff, and then they mass hire from the Philippines, and then it's very evident that they will give you those heavy patients right away, and then we keep on saying like, you have 4 patients. I give you one in the hallway. I said like, oh, I already have four. I said like, are you complaining? You're not done yet with your probation. I said like, okay. So I jumped. This is a hard pill that I need to swallow. And
Wow.
Bullying. Yeah.
and then
Bullying.
Yes,
yeah,
ma'am.
and
Yes,
then like
sir.
I even went to the bathroom and I went crying because like I said like, oh, I just don't want them to see me crying in front of
Yeah.
them. So I went to the bathroom and cried. I said like, wash, and then the show must go on. So eventually, when I moved to the US, and then I realized that this is not really good. You don't need to tolerate this behavior because you really need
Mm-hmm.
to advocate for yourself.
For
So
yourself.
so here in the US, in our facility, as much as possible, we want to reduce the pros of having safe staffing or nurse-patient ratio. Is number one is to reduce the burnout. Now,
Mm-hmm.
to be
True. I
honest,
agree.
we are considered to be the most number of well-staffed ED in the entire world, according to our director, and the most
Woo!
expensive ED.
Mm-hmm.
So that's why, and then our retention rate, to be honest with you, is 92%. We still have some people who
Wow.
not, not outside the system, but they are in the management role now because they are given a lot of opportunities. So that's why they said, "Oh, mahirap makapasok sa hospital." Yo, so I said like, "Yeah, it's kind of difficult, but once you're in, you will realize like you are safe. Once you get in, you know the feeling that someone's helping, like." This
Mm-hmm.
is actually a big thing for us. Like if you think when you go to work and you feel that your license is secured, your mental health is secured, your mental being, everything is possible with this particular team. So with that, aside from that, we reduce number of medical errors, and then konti lang talaga because like we have a lot of safety nets, and
It is
also
good.
improve like better job satisfaction and retention. Again, our retention rate is one of the highest in the US. And then it's very rare that, for example, this year, we haven't heard anyone quit, but we have two retirements.
Oh.
And then the other one did not actually quit, but they were promoted as managers from different areas because they said like once you came from the ED, you held like a charging position in the ED, you can go anywhere else because you've been to the most chaotic place, and then if you want to go to somewhere which is like chill, then it will be easy for you. That's according to them. So
Right.
again, safe patient ratio is beneficial not only for a patient but especially for you physically and
Okay, nurse.
mentally.
Yeah.
Mhm.
Mm.
Right, I agree with
Para
that.
na,
Yeah.
ano tayo? California na. Para na.
Yes.
Yeah, yeah. Well, let's all go to California. Yeah, but for me, it's also very important because, like, I agree with Nurse One before. Like, I don't want to come to work, to
Yeah.
hospitals that I work that are so busy. I don't even have the
Mm-hmm.
energy to sign up for extra because I just want to rest. It's mentally tiring. It's exhausting. I feel like I want an out. Like if I'm gonna do a PRN, it gotta be somewhere easier because
Yeah.
your body can handle so much, only so much. You can't do it all. Yep.
So talking about overtime, to be honest with you, this is our mentality regarding overtime. Okay, so it is a day that you're off. So our management will say that. So since it's your off, thank you for doing that, and we'll be giving. And sometimes if you're doing double or 16 hours, they will ask you which area of the ED you want to.
Wow, you can
Yes,
cook?
yes,
Yeah,
because
that's
to
good.
be honest, yes, that's our practice because like you are done with the shift and you're giving us extra time. The
Yeah,
mentality is not in the Philippines like, ay, the overtime siya, let's give them the heavy patient because
yeah, yeah,
he's
yeah.
paid.
True, true.
Boom.
No, for us is no. You are on your off and you came to us to help us, then we will give you some assignment that is actually lesser for you. Because
Yeah,
like thank you
I
so much
agree
for
with that.
doing that and I really appreciate that. And sometimes here's the thing about overtime for us. Once you start the overtime, it's time and a half right away. You don't need to wait for to exceed your commitment like
40.
40
Yeah,
hours for
Mhm.
it to kick in. So once the overtime is once the shift is overtime, offered overtime. So once you clock in, it's overtime. You clock out, it's overtime. That's
yeah.
how we reward people. And sometimes if our manager will, because we do our assignments a day prior. So if we lack some people, our manager will text us like, hey, we have overtime shifts available. In just 30 minutes, every shift is gone.
Oh.
And yeah, every shift is gone. Like, and most of the time, it's always Filipinos who will see their names, and then there's an indication. Oh, yeah, overtime na naman sila. Then for sure they're going to travel, they're going to do something. So lahat ng overtime filled. Rarely yet you can find that the overtime shifts are like no one will take that for sure. I mean, most of the Filipinos will take that shift. It's rarely zero. It's rarely zero. I mean, well, I mean,
Yeah.
you cannot you cannot say na Filipinos are not into overtimes in our ED. So overtime
Yeah.
for us is it's needed, especially if you buy something or if you're going to travel.
Yeah. So I think
Hermes. No, but yeah.
I think one thing Sir Marvin forget to tell is that may affect like stress is the travels. So if you're super a lot of like stress in the place, you tend to travel more.
Yeah.
Yeah, true, true.
Travel more outside of the US or anywhere. So that's typically way for us like for me personally is to desensitize myself from like the workload.
Mm,
So sometimes money is not really worth it, especially
Yes.
if
mm.
the
I
working
agree.
condition is that bad. So for those watching, try to get both. Okay, good money and good working conditions. That's the best
Yes.
kind
Right.
of scenario. So California, it is a dream. So like what Sir
Yes.
Marvin is saying. So
Yes. Also
Yep. And
regarding yeah,
yeah,
go ahead. Regarding
Marvin.
burnout. Yes, regarding
Yeah,
burnout.
go for
Sorry,
it. Go for it, Marvin. Sorry, sorry.
just advertising my facility. Okay, I'm not gonna drop my name of facility because like they're not
Stand
paying
for
me.
it.
Okay, so here's the
Let's
thing.
been around the bush.
If you feel like you're burnt out, we have EAP, Employee Assistance Program. That's like 10 free sessions for our like psych sessions. You're gonna use it within 6 months.
Therapy.
Aside from that, you can go FMLA for under EDD. So I use it before when I felt like I was like a lot of during COVID times, like we can't go out, like it was burnt out and all that. So I was given almost like 3 months free time, do whatever I want, and it's paid by the California government. So that's one of the
Wow.
best reasons why some people wants
wow.
to go to California for EDD. Even though like I was like was this for my mental health, like resting for my mental health, I'm still
Yeah.
paid by the government, by California
Yeah.
government. So
Here in
that's why,
Texas,
guys,
here,
yeah,
yeah,
go
here
ahead.
in Texas, if you want to go on a leave for mental health, yeah, you're gonna say, yeah, good luck. Good luck if you can still get your job back. I'm just kidding. So in short, there's nothing like that in Texas. But wow, that's good. But Marvin, here's my question very, very quickly. We know this is in your certain job place, and there are rules in California as far as overtime
Mhm.
and mandated ratios and all that. But as far as the work culture, because I'm hearing very good green flags for me, right? I traveled a lot, so
Mhm.
majority of the places I traveled here in Texas. So I feel like I've tried different flavors of ER. You know what I mean? And I already have red flags, like Nurse One was saying, if it's a toxic culture, or Marvin, you're saying if that's a culture where, oh, you know what, you're doing overtime, we're gonna give you more patients. I don't want to work there. I'm not gonna come
Yes,
back there. In
exactly. No.
fact, I'm gonna cut my contract, right? But I've also had hospitals that I know at the top of my head, I want to come back there all the time. Like
Yes.
right now, if they tell me you want to come back, there's an offer, I will, because not because the ratio that we don't have mandatory ratio, but also because my managers work with us. It's a
Mhm.
good working culture. Our charge nurses are very fair. You know, they take care of their nurses. So here's my
Mhm.
question. With your certain scenario and experience, is this only in the hospital that you want to name, but I will name Stanford? Or do you also hear the same thing with, for example, competing hospitals that we don't want to name, for example UCSF, right? Or the question is, no, we're not gonna try to say bad things about it, but the question is this hospital specific,
Specific.
or are the
Okay.
California nurses actually happier? Because I have friends in San Diego, San
Yes.
Diego, and Los Angeles, right? Um, some of their rates I'm seeing are almost similar here to Houston. So I'm
Mhm.
definitely not gonna work there, right? Because if I'm
Mhm.
the same money. So is this hospital specific? Because I have very good retention rates. I love working in hospitals with very good retention rates. 'Cause it's not a revolving door. It's not like today you're working with someone else new. Like, where's my
Yeah.
coworker? Who are
Yeah.
you? Because it's like that in most ER. Like, oh, you're new. Where's the other coworker? She got fired or she left? I don't know. It's so toxic, right? But what do you think? Is this local, or is this California in general?
Okay, so it's a yes and a no. Okay, so I'm gonna answer it's a yes and a no. So I'm gonna answer first the yes part. So as part of California Union hospitals, most of the most of the union hospitals they follow these rules, like the mandatory breaks, and then also the part of the overtimes, and also the what do you call it, mandatory breaks, and also the ratio. They have to follow that rule, and that's general among California. Okay, now I'm going to say specific. Especially the work culture is very very specific. I heard good things about El Camino. I heard good things about Kaiser. Not so good things on the other competing hospitals. So here are the things that you need to find out in California hospitals. Number one is I'm not gonna say I mean majority, but according to studies, if your hospital is providing like the like a what do you call it, like a fee, what do you call that fee? I forgot the name. Um, is that relocation?
Bonus,
Sign on
Or
bonus.
yeah,
Sign
sign on
on
bonus,
bonus,
bonus.
final
sign on
The
bonus.
bonus.
higher the
Yeah,
higher the sign on bonus,
The
the
higher
the
the
better
red flag.
Boom,
the higher
boom.
the red
the
flag.
bad it
Yes,
is. Yeah.
the
Come
higher the
here
red
for
flag.
$50,000. You're like selling
Yes.
your soul
Yeah.
to
So
Satan.
studies, yeah, studies have proven this one that if you have a bigger sign-on bonus, it goes to show that they're losing people. Okay. So I remember one big hospital in the northern Bay area gave this one, and then one of my coworker
Mm,
actually went there and then just tried. So after probation, he quit. They said like, "Oh, budol pa yang si ganito, si ganito." So, how did you know? I was there. I have my badge. See, I quit the next after my orientation. Why? Because like we have to do everything. The culture is not good. So something is like that. So this the work culture is like work specific, hospital specific siya. And also the benefits are also like facility specific. So for us, we don't have like the retirement benefits. Like some other hospitals, like especially state funded hospitals, they have this retirement benefits once you
Pension.
are 5 years or pension. Like after 5 years, you're vested with
Yeah.
pension. Kami wala. But our financial advisor is saying, why are you going to enjoy your retirement benefits if you can enjoy the money now? That's why we're paying you higher, and then that's why you are given like a bigger match up with 403k or in Fidelity and everything like that. So again, I've been to some hospital. I did travel assignments too, and then I'm not saying that my facility is perfect. So for as long as there is freedom for you to express your creative thinking and critical thinking, you feel
Mm-hmm.
that the environment is helping you, especially your leaders. Because to be honest with you, our management, they're not perfect, but they're amazing. They're very human, and they have this human approach that they will understand you first. They will talk to you in person. They know you by your name, and we have managers that is actually 24/7 coverage. So there we have in our ED we have like 8 or 9 managers and 1 director. So and then we limit like things that we value everyone's voice, especially if we think that your voice is valuable to improve the ED flow, improving the morale of the staff. So we value it. Again, I look for this characteristic in one hospital, that there's open communication, there's clear like process rules, and then also compensation and also the credibility. So I find it in this particular hospital. That's why I told myself like, yeah, it might not be perfect, but like I've seen all those checks, all green flags. I'm all for it. That's why I'm inviting people. Like if you think that you really wanted to be in California, just go in our facility, and I'm going to help you. Especially if you have questions regarding the interview, I can help. But of course, I cannot give you the questions.
But that's good. So
Noted, noted, Sir Marvin.
yeah,
Oh yeah,
yeah.
yeah, yeah. Again, watch out for those red flags. Also, try to ask people if you know someone who is working in that particular facility. What's the work culture? Again, it's as what Nurse One and Nurse Anna was saying. It's not about money, although you're being paid. So if you go, by the way, if there's a website in California that you can see who's the highly paid nurses among the county, you can actually see most of them are Filipinos in the top 10, like 600, 700,000, 800,000 a
Woo!
year. Yes, that's true. You can earn that, especially if you work in a particular state. But but the stress environment. When I ask them like,
Mm-hmm.
oh, what's the working
True.
condition there? Oh, there's a lot of bully. There's a lot of mafia going on. There's a lot of this one. So like, and
Yeah.
then like, here's the
Is
thing.
it
Try
truly
to
worth
apply.
it? Yeah.
Yeah, here's the thing. And the application is really really like messed up because I tried to apply, and then after 2 days I receive a rejection letter informing me that
Wow.
I don't have acute experience. I said like, I work at this particular level one trauma center, and it's even there. I said like, and then I asked my friend who's actually there. I said like, why do you think they didn't actually consider my application? I said like, oh, there's already someone for that position. Well,
Oh, you're a
there's
Mm,
a
threat.
big,
true.
I got, well, that's a big bullet that I have dodged because like I was trying to, because like I was so envy with during those times I was so envy. I want my name to be in that top 10 particularly because I want to earn 600,000 a year. Yeah, but after that,
Can we Google that top 10?
yeah, I mean, wait, I will get that way. Hey, yeah, I will
Yeah.
give you the website. Hold on.
Yeah, but the question is, like I like what Juan said earlier. Sometimes it's not about the money too, because
True.
like during COVID, guys, I was working 5 6 days a week on top of NP school, right? So
Mm-hmm.
um, I realized that after a year of doing that, my mental health was declining to the point that I'm exhausted. I feel like I'm bringing the stress from work to home. I'd literally be so empathic at work, empathetic, but at home I'm like a stone. Like, can't even
Zombie.
talk to me. I don't have an emotion anymore. Like, you know what I mean? Like,
You're
my
dead.
we would be out with friends. Of course, there's still COVID restrictions, but I could even laugh at their jokes because my brain couldn't process it. Like, I don't have emotion, and they're like, that's not you, because I'm usually one of the loud people.
Bubbly.
Yeah,
Mm-hmm.
a bubbly person, but something like that. So I realized it was also turning me to a different person, probably because I'm working too much. So sometimes money is not the reason. Not how do you say that? It's not everything.
Yes,
Mm-hmm.
everything.
But I think Dr. Nurse Paul, for Marvin and Nurse One, when we were new, when we are newly arrived of the Philippines, there are phases of being an immigrant nurse.
Yeah,
During the
true.
first 3 years, we are called the hustler nurse, right? We
Yes, true,
sign up
true.
for all the overtime.
Yeah.
First, we want to my point was the reason why I was taking a lot of overtime during that time was I want to learn more because I don't have experience working in exact floor. So I want to learn more. I want to be exposed. And then later on, I took the advantage of bringing client or patient to all different hospitals in New York City. We have an ambulance. So for me, that was a free ride. So I was able to, visit all the hospitals, riding the ambulance, bringing the client for the clinic appointment. And then, of course, the overtime. So, I was sending money back home. So those are during the first 3 years. But then later on, when you're out from your contract, you're getting the real pay from the hospital. You can to lessen your overtime, and then you become a traveler. So, I think there's phases of being an immigrant nurse. And knowing this nurse to patient ratio, if you are a newly hired nurse and you're working in US for a year now, don't worry, it will be over soon. You will be
Right, right.
free from your contract and probably work on your California license and go to California like for Marvin work. And for those who are current, please,
Yeah.
take note, always watch DNP. You can learn more, prepare for your US or your American dream. Even if you're here, I'm still learning. Everything is a learning game for nurses. And I'm so happy that I met these people. You need a great support that will help
True.
you, that you can be yourself, your real self without, bullying you, without harassing you, without judging you, whatever choices you make. So I'm grateful and I'm thankful I have these people in my life, Galifora, and Kay, we miss you, Kay.
We miss you,
So
Kay.
those are
Although
my
she's active in the chat right now. But yep. And okay, final words, guys. How important is advocating for nurse-patient ratios where you work, and what can we tell nurses right now here in the U.S. that are struggling with nurse-patient ratios?
for
Nurse
Marvin.
Marvin.
Oh, okay. So, by the way, a while ago we were asking about the website. So you can see the what do you call it? The highly paid nurses in
Mm-hmm.
Liberty County. So, Nurse Anna actually put it in the comments. It's
Yeah.
actually
Mm-hmm.
Transparent California. So, as you can see there, like the top 10, their salaries are like 600,000 and up.
Yeah,
Okay.
the
So yeah,
highest paid nurse is Kim Huang
yeah,
T. Truong, is a clinical
yeah,
nurse from Santa
yeah.
Clara, and 664,501.58. Okay, Kim,
Yeah.
thank you so much.
And then most of
for
that
your
will go to
service.
yeah, thank you for your service. So my
Thank you for your service.
Amazing.
so my final words again it's not about you have in the Philippines before we felt that someone is above us always like our
Mhm.
nursing is not enough, but here in the US we're in the same, we're helping helping our team to give the best experience and care outcome for our patients. Now, there are three things that I need to tell you. Number one is you need to advocate for yourself. Wag na po kayong mahiya. If you think that you feel that if your gut is telling you that it is not safe, I'm gonna risk my license. I'm gonna kill my patient. I'll be jobless tomorrow. Please don't do that.
Mhm.
Listen to your
Mhm.
instinct and then advocate for yourself. Inform your management, like, or inform your leader or inform your charge nurse, like, hey, charge nurse, I think I have a lot of things to do. Can you help me? Because if you fail to advocate for yourself, you're for sure gonna risk your license. You're gonna risk your
Mhm.
patient's life. The second thing is it's not about money. Now, sometimes they always say it's always the grass is greener on the other side, and also they say like the grass is greener where you pour it. Now, environment plays a very important role not only for your physical self but also for mental well-being. Would you like to get a lot of money than your coworkers are a lot of marites and a lot of like backstabbing and the work is so toxic? if you gonna, yes, I'm earning big, but those money for sure will be used for your medical expenses later on.
Correct.
So I'd rather be in a place that we have a lot of we are united, cohesive, we talk openly without any
Mm,
judgment, and there's always a safe zone for us. And also it's we develop this work life balance. Again, if you find that particular job that you are loved, valued, and you are given this creative and help you develop more opportunities, then I think you found a gold mine. And
mhm,
lastly, I just want to tell all those incoming Filipinos, please, there's a lot of red flags in every hospital. Try to do your research about it. Try to do like ask someone who's working there, what's the culture. Try to check your review for Yelp with a grain of salt, and then try to check also about what these facilities are good for. Again, there's not, I mean, there's no perfect facility. It depends on your expectation. If you think that all your things, like the things that I like, which is open communication, credibility, leadership, and compensation are there, then you just found a good place to work. And the most important thing about safe patient ratio is patient safety. So once you feel safe, your patient is safe. Right? That's all
true.
for me.
Nurse one.
Okay. Add on lang for things that what Sir Marvin said. So for
Mm-hmm.
me, protect your license, because protecting your license, protecting your future, protecting your family. So that's the number one thing you have to take note, guys. Okay. And also like the research part, you really have to do your research individually,
Mhm.
not per state, sometimes per particular hospital. Okay. Because just heard a little bit last week. I spoken to some of my colleagues. They're working in a HCA hospital in Dallas, and they said some of the setup is not as really good. Not much help, not much
Not safe.
benefits. Yeah, it's like they have a good ratio. So like 1:3, 1:4, but there's no 8. There's no like charge nurse gonna help you.
Oh
Mm.
no.
So you really have to ask those questions. So
Yeah.
and they don't even have like a transport people to push patients to like
Oh
Phoenix
yeah.
Med. So one of my colleagues who's like a small Filipina, and I think she has to push her patient. So from ICU, she has to push her patient by herself.
Oh.
So I was like, uh, that's not like not a good place to work. Really, that's a red flag definitely. So you
Too much
really
work. Yeah.
yes. And even
Mm.
though they have the same program, same ratios, you have to see how they handle things. So it's really
Mm-hmm.
nice to
Mm.
connect with someone like through Lefora, to connect them, get some information on how they really deal with patients or their like
Mhm.
patient care setting. So just to give you a better idea, okay? Because some of you might have the idea of USA, so it's like California setting, but unfortunately
Mhm.
it's not. Okay, I think like Sir Paul said, there's only like 4 states has this mandate. So other states doesn't have it. Okay, so
Mm-hmm.
it goes whatever it goes. So unfortunately for us, so you really have to be prepared for this. One thing that can really help you is to have an experience. Okay,
Mhm.
I read someone in Lefora like they're saying like really hard for them the first few months. Usually I see this if you're a new nurse. Okay, but if you have like a seasoned nurse or more
Experience.
experienced nurse,
Mhm.
those things can go faster, like a week or two adjustment, and you're done. Okay, but if you're
Mhm.
new, there's a lot of uncertainties. So, what I can advise just for you just to hold on, learn some stuff, do some more research, and um, just learn, and eventually it will get better, get easier, especially the anxiety part. Okay, so being an anxious person before, it really gotten better like after a few years, and to the point where it's like it's like wala na akong pakialam. It's like, okay, so okay, I'll get this. Well, I'm not
Right. Right.
anymore. It's like, okay, I'll do this. Okay. So, so, it, so just hold on, guys. Okay, it gets better through experience. You know.
All right. How about Nurse Anna? Thank you, Nurse one.
Wow. Final to add. If you want a better nurse, patient ratio, go to the LR. 1:1. Diba? Walang kawala yun. Bakit na yun? Basic. But
Di
you
pa
know, when you
nagsalita, no?
arrive here, yes,
Wala bang 1:0?
Di pa
Yung walang
nagsasalita.
patient.
no, there's none. 1:1, you have a CRNA, you're not gonna do medication, you're not gonna post antibiotic. You have a scrub pair. No, no, I'm just kidding. Well, nurse expectation versus reality. You know, money for expectation. It will be difficult during the first few months or weeks. Give yourself time to learn and let what my amazing colleague was saying earlier, advocate for yourself by
Mhm.
educating yourself and advocate for your patient and a lot of prayers and divine intervention and don't be shy to learn ask questions. What's DNP Unlocked every Sunday? Follow these wonderful people for Marvin as education and academe. Nurse
Marvin the
One,
Explorer.
subscribe. Yes.
Kidding
And
name
Nurse
time is
One,
Mr. Marbs.
Follow
subscribe
our
to
nurse
his YouTube.
influencers and turn
There's
Yes.
turn on notifications so you can receive notifications
Yes.
when they upload reels right away.
Yes, follow the DrNursePaul. He loves to give free classes. Saan ba naman yan? Noong panahon ko wala yan.
Yes.
And,
Right. So
okay, even if he's not here, she posts a lot. Alam niyo yun? So,
advocacy
educations are
yes.
out there. Free. So, you have no right to tell us na, oh, I didn't know that. There are resources. Just give
Yep.
yourself time to learn them. And, don't give up. Minute on a man or not, do not stop praying for your American dream. You lang.
Right.
Thank you,
Right.
everyone. I'm so happy to be here.
Right.
How about you, partner? Oh, last
My
word.
final. Yep. Marvin, Juan, and Anna said really great points. I think we're all over the place because you guys are here.
yeah.
Anyway, my message to everyone is advocate for nurse-patient ratios. Know how much
Mm-hmm.
patients are given to you before you accept the job. See what the state mandate is, because like I said earlier, like we talked about it, not majority of the states don't have a ratio. So be prepared that when you go to work, they might give you more patients than what is mandated or what is accepted in your policy. Know the policy, and also advocate for nurse patient ratio at the local and state level if you can get involved. I'm involved with Texas Nursing Association, Texas Nurse Practitioners. In my own little way, I advocate. I talked about it in my own little community, but advocate for nurse patient ratio. It is about time that we talk about these things, right?
Mhm.
Nurses, like Juan said, like Marvin said, safe patient ratio means patient safety, means overall healthy nurse, physically, mentally, not exhausted, not unempathetic, nurse full of compassion. I want to highlight this to all nursing leaders, hospital owners, corporations. We have to take care of our nurses. If we want our nurses to take care of our patients and community, and follow all these quality rules and press Gainy what's this course to improve your reimbursements,
Survey.
take
Mm-hmm.
and surveys, and have the community love you and give you 5 star and Google review. Take care of your nurses, because if the nurses are not happy with their jobs because of all these issues with nurse patient ratios, assignments, workplace culture, toxicity, right? um, Nurses will not really last. We want nurses in the bedside. We have to do something about it. Let's all focus on the well-being of nurses as well. It is We cannot provide patient care to the highest quality if we are not
Burnout.
100% well. You know what I mean? It is very hard. But that's about it. Thank you, Juan and Marvin. You guys are invited again. And every Sunday, of course, you guys are invited. But Nurse Anna, next week our show is about, this is your choice, Anna, okay? Hot topics, especially in my Facebook Reels and Instagram Reels.
Oh my
Just follow me
god.
for more information. But we're gonna talk about APR and scope
Oh,
of practice, like what is APR and scope, what do they do, and full practice authority,
do I
collaborative
call you doctor?
agreements. Should you or should you not? We are going to talk about that next week. And guys, tomorrow, all right, tomorrow morning here in the States, it's Monday, September 16, 8 a.m., I think. I have a free class in my Facebook, also through AMN. It's going to be Next Generation NCLEX case study 1 hour. If you guys can join me, but it's also going to be uploaded in YouTube. And that's
Mm.
it. Thank you, Nurse One. Thank you, Marvin. Guys, please follow
Thank
all
you,
our
Dean.
great
Pasha.
leaders in the
So,
nursing immigration community. Thank you, guys. Have a
Yeah.
great Sunday.
have a great
Good
Sunday,
Bye.
night,
guys.
Sir Marvin. Thank you,
Good
Nurse
night. Good
One.
Bye,
night.
one.
Bye.